Trunk rotation while sitting with the pole behind the back. Aims of the test. A. To diagnose quality of vertebral movement in trunk rotation. B. To diagnose asymmetric patterns of performance on each side. What is full range of movement in rotation? Different ranges of rotation between parts of the spine, lumbar, thoracic, and cervical. About 40 degrees in the thoracolumbar region and about 80 degrees in the cervical vertebrae. The range of rotation in the lumbar section is only about 5 degrees. This is how it looks from top view. The thoracic spine should be 35 to 40 degrees. The rotation between C2 to C7 is about 40 degrees. Additional rotation between vertebrae C1 and C2 is about 40 degrees. What to do? The patient sits on a chair and performs trunk rotation holding a pole across the back. What is normal condition? Integrative rotation of the lumbar and thoracic spine. The angle of the pole reflects total rotation of the lumbar and thoracic vertebrae together, 40 degrees. Observing the head angle will give us an overall measure of total rotation, including the cervical vertebrae, normal, 120 degrees. The differential between the head angle and the pole angle represents the actual addition of cervical rotation. What are we actually testing here? This test examines intervertebral joint mobility, which is dependent on the soft tissues, ligaments, fascia, and muscles. Some of the ligaments that stabilize the spine. We do not test the ability of muscles to stretch, but rather segmental mobility between the vertebrae and the joints. Possible compensations. Compensation: lifting and tilting the pelvis. And we must make sure the pelvis is stabilized and motionless. What do we expect to see in non-normative conditions? 1. Lack of balance. Thoracic 25 degrees and lumbar spine 40 degrees. Good movement to one side 40 degrees and limited movement to the other less than 40 degrees. 2. Limited range on both sides. Common in patients with hyperkyphosis. At the same time, in many cases, even without hyperkyphosis, rigidity is created with limited range of movement. Avoidance of rotation in daily functioning. Lack of exercise or rigidity caused by other factors. Functional problems of lack of balance can be improved and corrected through practice and training. Lack of balance will guide us to include rotation in the training to soften the rigid side. Other points to observe. Is rigidity evident in part of the spine? Is the rigidity cervical, thoracolumbar, or combined? To this end, we will perform cervical rotation separately, and based on the results, we will adapt the type of exercises to be used.